Okay, very good morning, students. Very good morning. I think we are loud and clear. So many doctors are telling me that sir, volume is not up to the mark. See, I'm just adjusting the volume. I think now you can hear me. Okay, just 1 minute, 1 minute, 1 minute. Yes, I think we are here. Okay, fine. Uh, So recently we got a information update, doctors. We got an update regarding medicine. It's the latest update. It's the latest update we got regarding medicine regarding INICT 2024, right? INICT 2024. So what is that update? So the pattern was changed nearly 65 percentage. There is an update. The pattern of the questions that are about to come in INICT, it was changed nearly 65 percentage. 65 percentage questions you will be getting this time in a different pattern. Why? Because NMC wants to change the pattern of the INICT, because the previous sessions of INICT examination that was held previously, they are not satisfied with that. So the so-called the committee wants to change the exam pattern. Actually, it was not officially done, but actually we got some sorts of information like the pattern of the questions will be changed, and you will get most probably questions regarding neuromedicine as well as endocrinological medicine, endocrinology medicine oriented questions covering nearly 35 percentage this time. Why? Because the recent studies or recent statistics of India are speaking like most of the cases, most of the scenarios which we observe in the OPD clinics are recently there's a spike in the neurological cases. Why? Because diabetes, hypertension, these cases are increasing day by day. So the so-called the committee wants to make a little bit change in the exam pattern so that the students are much aware about the clinical aspects of the neurological cases. So they wants to bring awareness in the students regarding the clinical aspects while dealing with the neurological cases. So what is that condition, right? So what is that scenario that we are about to see in this INICT exam? That is called reverse caudal strategy. Reverse caudal pattern. So what is this reverse caudal pattern? Previously, we were given a clinical aspect and we were asked to diagnose, or we might be asked to get the treatment of the answer of that MCQ which was given. So either the examiner asks you the diagnosis or the examiner just expects the treatment from your mind. But this time, this INICT 24, it's a little bit reversal in nature. The MCQs will be a little bit reversal in nature. This time, you will get an MCQ like, so the patient was treated with a particular drug, right? The patient was treated with a particular drug, and you will be asked the question like, all of the options or all of the following can be sected upon the diagnosis except. That means that the diagnosis will be asked you in the pattern of differential diagnosis. You will not be asked sure shot diagnosis. You will be made to guess the differential diagnosis. For example, I will tell you, I will explain in an even more better way. You will be asked in a MCQ. So in that, the options, the MCQ will be like, all of the following can be noted in the differential diagnosis except. That means all of these options, option 1, option 2, option 3, for example, all these options can be noted in the differential diagnosis except. So you will be getting a question depending on the differential diagnosis. That means, for example, if a group of clinical symptoms were given in the MCQ, then you should be able to sort out which option can be a differential diagnosis depending on the clinical symptoms and which option cannot. So this time, this 24 INACT, you will be getting this pattern of question, that is 100% damn sure. Right? Now, what is another aspect that you need to do it? And one more thing that we are expecting this time is you will be given a SPM question. You will be given a SPM question, but you will be asked the pathological scenario of the condition. You will be given an SPM question, but you will be asked the pathological scenario. It's a complete reverse nature. It's a complete reverse. There is not at all, there is no sort of relation between SPM and pathology. There's not even a 1% of reference between these two subjects. They are completely both are different scenarios. But still, you will be getting a question on the SPM, but still you will be asked in a pathological aspect. That's really a troublesome thing. Why? Because if you are given a pharmacology question and if you are asked to deduce the medicine answer from it, yes, you can do it. If you are given a gynecological question and you are asked to deduce some anatomical aspect from it, yes, you can do it. But if you are given an SPM question and you are asked to deduce a pathological aspect from it, it's something like making you confused. So this 24 INACT, you are getting even this type of pattern also. And one more thing. So previously the videos were taken out, right? Previously videos were given, but after a couple of times the videos were stopped. But this time video as well as audio will be given. Video and audio will be given, but sometimes we might expect only video only. In this video, you will be asked what are the complications which you can see in the video except. So in this video, you can observe the complications. Yes, the video will be like that. I can't explain how it will be, but I can give you a picture. Like you will be given a video, something like point or something like 3 seconds video, and you will be asked what are the complications except. So you will be given 4 options, right? So what are all the complications that you can expect from the condition in the video except? Okay, see, it's an example. Now 4 is not the answer, but I'm example, I'm just keeping it. So this type of pattern. So these all are called reverse caudal patterns, RCP. Now there is one more thing, that pharmacology, and I want to talk about pharmacology. Pharmacology updates, so many doctors are asking, sir, regarding updates of INACT, that means updates, what updates, up to what timeline we should be thorough with the updates. See, INACT is something which is very much fond of updates. They love updates. So if you ask me, for example, INACT will be held in May, right? So you should be thorough up to February. February of 24, you should be thorough with all updates. But if you ask me, sir, which subject updates that we should follow? Which subject updates that we should be getting up? If you ask me like that, wait, I'll tell. If you ask me like that, surgery, no, sir, not surgery, medicine updates you should follow. But you may ask like, sir, in medicine what? In medicine, you said simply broadly medicine. In medicine what? In medicine protocols. Protocols. Sir, where we should get these updates? Whether it is in online, whether it is Google, whether it is Yahoo, where you should go for Indian Medical Journal. Indian medical journal. As well as there is one more journal, that is AIMS journal. You should be thorough with these two options. You should be thorough, absolutely thorough. Now, sir, you said protocols, but which protocols? Which protocols are we speaking about? ATLS protocol, BLS protocol, and criteria. Criteria, very, very important. Criteria. Some criteria, they will be changed from year to year. So you should be pinpoint perfect with the criteria. And what are the other updates that you should follow? As you all know, you should go on with the SPM updates also. You should be thorough with the SPM updates also. Sir, in SPM, which updates we want to? All you know, the government schemes. The government schemes. Previous year in 2023, Modi government has introduced some 5 to 6 schemes. You please be thorough with these schemes. I'm expecting at least 2 questions from those schemes, right? Why? Because next year also you will be getting the Modi government, so obviously you will be getting 2 questions from those schemes. That is damn sure thing, not at all. You don't even doubt about it. So schemes of Modi ji government will be represented as MCQs in your INSE. That will be damn sure. Now, if you ask you some other things, so what are the other updates? Schedules, immunization schedules, antenatal schedules, and some of the microbiological schedules. Everything you should be updated. Sir, where we should get updates of SPM? Simple, online. Nothing much, online. In the government website only, Indian government website, no other resources. Indian government website is standard. Why? Because these Indian government website schedules are updated by none other than the Central Institute experts. That is nothing but AIMS, PGI, these central institutes only. They will update this one. That means these people are the resources for these updates. Okay. Now, if you commit like, sir, what about other updates? Pharmacology. Pharmacology, very, very important. You should update 2023 drugs list. Recent drugs, approved drugs, marketed drugs. These all should be updated. That is very important. And what other aspects of pharmacology we should get updated? You should get, now this time, this INSET, there is one more update from pharmacology aspect. You will be getting the recent complications that were noted recently regarding essential drugs. Yes, essential drugs. So the recent complications that were recently noted regarding the essential drugs, this most commonly used drugs, Schedule H drugs, right? So those recent complications which were actually recently published, so that will be asked as a MCQ question, that is for sure. And sir, regarding surgery, anything you want to speak? See, regarding surgery, there is nothing much that you can do it. But if you ask me regarding surgery, I can tell you one thing. Please be thorough with the anatomical aspects of surgery. Please. Anatomical aspects of surgery. Very, very important. This time you will be given an anatomical image and you will be asked what portion of the viscera that are appearing in the image will be resected. You will be asked that MCQ this time. That is for sure, damn sure. That MCQ will come. You will be given an anatomical image and you will be asked a question like what parts and what are the regions given in the following image will be resected. So you should be very much thorough with the surgical anatomy. Very, very Very, very important. Surgical anatomy, very, very important. And one more thing is, we got an update regarding emergency medicine. Emergency medicine, that you will be getting a something like, ICU questions. ICU scenarios will be given as a question, and you will be asked what will be your next step. This time you will directly get an ICU scenario. One MCQ will be getting. And one more thing is, you will be getting questions from the forensic medicine. This time, this is also in a clinical aspect. How? For example, a murder has occurred and the body was dumped. It was kept buried. Now the judiciary has suggested the police ordered the police department to reinvestigate the forensic aspects of the body. Now, under what section it will be included, right? Or you will be getting a question like, a 23-year-old female met with a road accident, and the police came and took the statement from the nearby witnesses. Under what section it will become? Or you will be getting a 24-year-old young doctor is doing his regular rounds, and while prescribing a medication for a complaint that was given by the inpatient, the doctor has prescribed a wrong medicine. Under what section it will be included? Or you might be asked an MCQ question like, what sort of punishment the doctor can face? See, these are actually simple questions. These are not like, that huggy-buggy questions. No, these are actually simple questions, but they will trickle you. They will simply trickle you in the exam. See, if you are watching this video, if you are just sitting in front of your phone, you might think like, yes, these are that simple, man. These are that simple. But just imagine sitting in the exam hall for 3 hours. And the tension that is being filled up inside your mind, and just imagine that environment at that point of time, how your mind will work. You just make a difference between the two environments. That the environment in which is present in your house, sitting in front of the phone and watching this video, and you are sitting in the exam hall and just watching all those MCQs. See, both are two different environments. So these aspects look like simple, but they will trickle you. That is for sure. They will trickle you. Literally, I don't want to say this word, but if you just think like, oh, these are all simple things, I have already studied in my MBBS things. The only thing these are direct questions. I can simply use my common sense that no, you are just fucked up. If you do those things, you are fucked up. You should keep your mind present, clean, tension free. Else, remembering the sections of forensic medicine, it look like a bread and butter, but still if you feel like tense, then it will look like a dinosaur. You are just searching for a pin in a haystack. You can never get that pin if you are tension. See, don't think like everything will be simple. It looks simple, but sometimes it can be tricky. So this time, this 2024 session Inicet will be something like, it will be okay, but still you should have that complete presence of mind. You should intermingle each and every subject with another subject. Then only you can solve the MCQs. You go blindly. Yes, you should revise your notes. There is no doubt in it. You should revise your notes and you should do everything. But the most important thing that I always yell and I repeat is you do MCQ, do MCQ, do MCQ. Don't neglect MCQ. Please, I'm requesting you, don't neglect MCQ. You do multiples of MCQ. And see, it's not about solving MCQ. It's about understanding MCQ. You understand the topic. You intermingle the MCQ. You create some MCQs. Right? Then you do it. Okay? So these are the updates that we got still now. I think by the next, after 5 days, we'll be getting some more updates. We'll be getting back to you. Till then, revise the notes, study well. Goodbye. Thank you. Wisdom.